I'm going to read to you Dr. Copland's Psychosocial Assessment of me, which he wrote on May 3rd, 2025. He said, Andrew Kolowski is a 36-year-old male, unmarried, domiciled, with his mother and stepfather, who carries the diagnosis of schizoaffective. He is prone to both grandiose ideation and manic features as well as paranoid psychotic ideation. These symptoms have their origins in his high school years, and the patient has been hospitalized more than 6 times, in large part due to non-compliance with medications. His initial presentation was incessant walking on the road, which could last at least 4 to 5 hours a day. There was no specific reason for the walking, but it and other psychotic and manic features responded to Invega, lithium, and lamotrigine. He was referred to Dr. Michael Garrett for cognitive behavioral therapy for psychosis with positive effect. His delusions, which were amplified by high caffeine intake and incessant internet use, were that he had been sexually abused as a child by family members. The delusion had an episodic nature and is characterized by periods of non-psychotic clarity. Andrew desperately wishes his delusions to be public knowledge and regularly posts various versions of his delusions on the internet. Although he had no recall of any sexual or physical abuse from his childhood, he was intermittently able to understand the delusions as a metaphor for deficient parenting. His parents divorced when he was 10 years old, and he was exposed to his father's female friends at a young age. Almost simultaneous to the manifestation of delusions of abuse are grandiose delusions in which he claims he has been secretly observed by Hollywood celebrities who are planning any day now to announce to him that he is a superstar and deserving of an affluent and high-profile Hollywood lifestyle and whisk him off. These delusions are episodic in nature and can subside within hours back to non-psychotic periods. His meds are now Abilify 10 milligrams, which is the consequence of stiff bargaining conditions laid down by his mother, that if he does not take his medications, he will have to leave the house. The Abilify 10 milligrams is sufficient to stop physical acting out and hospitalizations, but not sufficient to stop delusions. I have recommended clonazepam to Andrew and his family to mitigate the delusions, but Andrew refuses. He has made some headway through the Fountain House attendance. He attends weekly NAMI events and enjoys being a stand-up comic. There is no doubt that the almost daily delusions and manic ideation prevent him from pursuing gainful employment. Assessment: stable but ongoing psychotic episodes, no substance abuse, no hallucinations, no S&H ideation, positive delusions, diagnosis, schizoaffective disorder, plan Abilify 10 milligrams a day, psychosocial support, encourage activities outside the house, continue to encourage the clonazepam option.